Hello everybody and welcome to the Tuesday edition of Video Clips, and I have a couple of announcements, some exciting stuff coming up actually. March 12th and March 19th are the advanced study dates for the month of March, and we're going to be talking about Peter Gotchke's new book called Deadly Medicines and Organized Crime. Lots to talk about. I mean, hard to believe, you can't make this stuff up. And I'm trying to condense all this down, make it understandable. I mean, if you've read the book, we'll have a great discussion. If you haven't read the book, I'm giving you slides and all sorts of things that might save some of you the trouble of reading the book if you're not that much into buying expensive medical textbooks. But anyway, that's coming up. March 17th, we have a special guest speaker on a conference call. Her name is Jennifer Brown. She's written a great book on irritable bowel syndrome, and she's going to be our guest. And then announcing the Diet and Lifestyle program is open for enrollment. It starts on June 4th, and this year, not only do you get the great instructors, Dr. McDougall, Dr. Esselstyn, and the usual crowd, Dr. Moss, Dr. Pilevsky, but it qualifies for 39 continuing medical education units for doctors, 39 for nurses, and 39 for dietitians. So you can get continuing education credit for taking the class this year, all three occupations. So now we'll move on to the topic. We're going to do part one today and part two on Thursday. I want to talk about how drug companies sold attention deficit disorder to the public. I get a lot of heat for this issue, by the way. People writing and screaming at me in capital letters that I don't know what I'm talking about, that there are people who have ADHD and that not medicating them is terrible. But I think when I finish telling you this story, and this is just one of a whole lot of stories like it, you'll see that I'm right about this issue. Okay, so where we begin is Dr. Keith Connors is a psychologist, and he was one of the early advocates for medicating children for attention deficit disorder. At a recent conference, he presented data from the Centers for Disease Control that show that 15% of high school students have been diagnosed with ADHD, and 3.5 million American kids are now medicated. He called this, quote, a national disaster of dangerous proportions. Now, this is a guy who really was an advocate in the early days of this, saying medicating kids is a good idea, and he says it's gone too far. How did this happen? Largely due to the incredible marketing machine of Big Pharma. The drug companies have now been so successful in their efforts to go after kids, and obviously by the number of kids that are medicated, we can see that. They are now targeting an even bigger group, which is adults. While some health professionals still hang on to the idea that 5% of kids really benefit from medication, and I disagree with that opinion, by the way, even proponents are now saying that so many children with few symptoms are being diagnosed and given medications unnecessarily. The Centers for Disease Control lists attention deficit disorder as the most frequently diagnosed long-term condition, second only to asthma. The drug companies' inclusion of behaviors like carelessness and impatience as criteria for diagnosis means that all of us could be diagnosed on a given day of the week. The drug companies, in order to get their way, have repeatedly made false claims about the drugs. In fact, every company that makes drugs for attention deficit disorder and every drug has experienced some type of fine or sanction since 2000 for false and misleading advertising. The truth is that the drugs are in the same class as morphine and oxycodone and are just as addictive. And I'll tell you, I think it's criminal, the fact that we put little children on these types of drugs every day. Shire Pharmaceuticals, for example, was fined $57.5 million last year for false statements in the marketing of its ADHD drugs. Now, these types of fines, even when they get into the billions of dollars, doesn't deter the drug companies. They just consider that a cost of doing business, and I think they operate under the assumption that it's easier to beg for forgiveness than ask for permission. Not so good when you're talking about giving children toxic drugs. The drug companies are actually kind of ruthless with their strategies. They not only target the parents, but they target kids with marketing pieces like comic books that include comments like, medicines make it easier to pay attention and control your behavior. Well, it's paid off for them. Profits for ADHD drugs reached $9 billion in 2012. The use of celebrities can make the drugs even more appealing. Maroon 5 member Adam Levine now endorses Concerta with an ad that says, it's your ADHD, own it. I mean, I just find this disgusting and despicable. Quizzes posted online by the drug companies are designed to show everyone that they need drugs. The questions are deliberately vague and overreaching. They include things like, do you make careless mistakes? Or do you get impatient while waiting your turn? I mean, I can answer yes to those questions. The problem is there's no definitive test for attention deficit disorder. It's the observation of parents and teachers and doctors who have limited contact with the patients that result in diagnosis, if we can even call it a diagnosis. The drug companies' efforts could not pay off without willing doctors to buy into their strategy. The maker of Adderall, when the product was first introduced, sponsored conferences at which doctors told other peers to, quote, educate the patient on the lifelong nature of the disorder and the benefits of lifelong treatment. But the statement was patently false. There is no evidence. There have been no studies showing that the drugs are safe or that adults who were given the drugs as children or engage in long-term treatment are any better off than people who don't take them at all. Slides presented at one conference claimed that the drugs were, quote, generally mild, while the clinical trials showed that they caused insomnia, severe heart problems, hallucinations, and psychotic behavior. Keep in mind when I say that these drugs are prescribed to 3-year-old little children. Other slides claim that children with ADHD grew into adults who have problems with employment, fatal car wrecks, unwanted pregnancy, and criminal activity. They didn't mention that there aren't any studies showing that the drugs reduce the risk of any of those things. The presenter, Dr. William Dodson, acknowledges that he diagnoses 300 patients per year and he medicates all of them. He gets paid well for telling other docs about his fabulous strategy, $45,500 in 2010 and 11 alone. He's not the only one. Makers of ADHD drugs paid Dr. Joseph Biederman at Harvard $1.6 million in fees. Of course, he claims the payments have not influenced his research or conclusions. Right. Biederman's enthusiasm for drugs knows no bounds. In one interview, he said, if a child is brilliant but doing just okay in school, that child may need treatment which would result in their performing brilliantly at school. Are you kidding me? This guy's suggesting medicating kids that are doing okay in school so that they can succeed. He also told a Medscape writer in reference to medication for ADHD, don't leave home without it. How sweet is that? Many people, including doctors, overlook the ridiculous of these statements due to Biederman's Harvard credentials. Biederman and others like him, and I think they have no conscience, have enabled drug companies to advertise their drugs with slogans such as those claiming that medication will, quote, allow your patients to experience life's successes every day. Well, there's more despicable news to follow, and I'll come back on Thursday and finish the story. But until then, feel free to pass this on to anybody who you think might enjoy watching it. Have a great day, and I'll be back on Thursday.